Well, let's look at it as an antidepressant. Does it work very well? The company says yes. Our studies show that the drug is a very good antidepressant, and it works in more than 55% of the cases. Well, the company sort of used their own standards. They didn't use the standard method that was then current for evaluating antidepressants. So, since the company funded the studies and since the company judged what kind of comparison scales they should use, yes, indeed, it came out as a relatively good antidepressant. Now, more critically evaluating the drug, it was found only to be a smidgen more effective, if that, compared to a placebo therapy. And even while people had depression, if it got better while they were taking the drug, they had about a 20% chance of relapsing right on therapy. So the Cochrane group in 2012 evaluated the drug compared to all the other antidepressants, and it said it's no great shakes, and it actually wasn't any better than the Prozac or the Zoloft or the Cymbalta or any of those other newer antidepressants, but they said it has an increased incidence of side effects, and as a matter of fact, they didn't recommend it as a first-line antidepressant. But because it was so heavily advertised, because it was on the television all the time, people saw it, people and the doctors prescribed it, and all of a sudden we had a drug that was used and thought to be very good, when in reality the quality of the evidence and the supporting material was relatively low.